Our group is Ellison Preschool, and our group consisted of Bianca Aspe, Megan Bishop, Madison Malott, Lacey Baines, Patricia Kostoff, and Amber Young. Bianca is an RBT in a clinical and home setting in Colorado. She has 3 years of experience as an RBT and 1 year in special education classrooms. Megan is an RBT in clinical setting in Georgia. She has 2 years of experience as an RBT and 7 years of experience working with individuals who have disabilities. Madison Malott is an RBT in clinical and home settings in Michigan. She has 2 years of experience as an RBT and 4 years of experience working with individuals who have disabilities. Lacey Baines is a behavioral therapist in a clinical setting in Georgia. She has 2 years of experience in ABA and 4 years of experience working with individuals who have disabilities. Patricia is an RBT in clinic and home settings in Colorado. She has 1 year of experience as an RBT and 3 years of experience with individuals who have disabilities. Amber is also an RBT in clinic and in a school setting in Illinois. She has 1.5 years experience as an RBT and 3 years of experience working with individuals with autism and other disabilities. We felt as a group that PECS and video modeling would be a good fit for Ellison Preschool because there are many children who attend Ellison that did not have a consistent method of communication and they didn't have a repertoire of cooperative play skills. Many of the students in Ellison Preschool are experiencing tantrums and lack of cooperation between peers during playtime. We felt if we were able to increase their communication, we would provide a replacement for the tantrum and swiping behavior that the school is experiencing in all of their classrooms right now. PECS is a great low-tech way for peers to communicate with one another, especially if some of the students are nonverbal, because anybody can use PECS. It'll be effective across peers of all communication styles and ability levels. PECS is a low-tech system of communication that can support many individuals of various needs. PECS can be used to communicate with both adults and peers in the individual's environment. The system of communication consists of pictures on what is approximately a 1 inch by 1 inch icon, and the icon will show an action or an item that is desired and it will be placed into the hand of the person they are attempting to communicate with. Video modeling is a teaching procedure that involves somebody watching a video showing a task that the person needs to perform. Once the video has been viewed, the participant is directed to perform the task that was modeled for them in the video. Video modeling strategies are various, but they can include video self-modeling, which is the learner watching a video of themselves, point of view modeling, which includes somebody else modeling for them, or video prompting, which is somebody else modeling and they include a voiceover or a narration of steps that the learner needs to follow. Damon Burke, McGuff, Stump, and Naylor completed a study in 2016 that examined the effects of a social intervention with peer-mediated interactions. It included a neurotypical child and a peer who had autism, and they were using PECS. The study was a single-subject A/B design, and it measured for social interactions, specifically for the child with autism and low verbal skill. The study included 4 children diagnosed with autism and 7 children with no recorded disabilities who are all preschool age. Results showed that all 4 children improved in peer-directed communication, and this includes both instructional time and playtime. 2 out of the 4 children showed an increase in FCT when they were required to share. A study completed by Payton, Kodak, Fisher, Ghali, and Busine in 2012 examined the effects of differential reinforcement for an alternative behavior, or a DRA, and prompted peer-directed commands for preferred items through PECS. This study was a multiple baseline across participants, and it included a reversal design. The participants were both boys, and they were 7 and 9 years old. Both of the participants had an autism diagnosis, and both of them had limited vocal communication. The results of the study showed that during baseline, adult-directed commands were higher than peer-directed commands. Following the intervention, Both participants showed an increase in peer-directed demands.
As we have previously discussed, video modeling is considered to be a teaching procedure that allows an individual to watch a video in order to learn and perform a new task. In order to support the effects of video modeling, a study done in 2000 was able to observe the effects of video modeling versus in vivo modeling, which is also known as live modeling, in order to teach new skills to children with autism. All participants in this study were broken into two conditions. The first condition was considered in vivo condition or live models, and the other participants were exposed to the video condition. Results from this study were able to conclude that video modeling leads to faster skill acquisition versus in vivo modeling was more effective in order to promote generalization for their students. As we dig into more research that supports the effects of video modeling, the study presented in 2012 investigates the use of video modeling in conjunction with PECs in order to increase independent communicative initiations from children with limited communication skills. Throughout this investigation, the study was able to examine that the effects of using video modeling was also able to enhance the efficacy of students learning PECs. End result, the study demonstrated that all students learned to use PECs while also increasing the number of independent social initiations. The study was also able to indicate that learning occurred quicker when using video modeling. In order to implement the steps for video modeling, it is important to first select a target behavior to teach. These behaviors can include communication skills such as asking for help, daily living skills, and more. Remember, when selecting a target behavior to teach, also define the behavior in observable and measurable terms. Next, it is important to obtain necessary equipment. Necessary equipment can include a handheld camera, a phone, or any other recording technology needed for creating a video. It is also important to have a method for the participants to view the video, which can include using a computer or a television to show the video. Please familiarize yourself with the technology before implementation. Next, creating a task analysis for the target behavior is important. Depending on the skill, steps may need to be broken down into a complex sequence of steps. Include a list of all steps that are needed to complete the target behavior for yourself. Next, collecting baseline data before the beginning of the study is important. By collecting baseline data, practitioners are able to gain information on what the learner can do independently, thus, demonstrate the steps needed for that individual. Next, it is important to choose the appropriate type of video for the learner. Video modeling varies, including video self-modeling, point of view modeling, or video prompting. Choosing the type of video may be chosen depending on the type of task, skill, or behavior being taught. Next, it is important to select the appropriate type of environment for the learner. Arranging for the appropriate type of environment for the learner includes having minimal distractions and in a natural setting close to the target behavior. Next, show the video. Some individuals may require prompts to stay on task and watch the video, while others may need less support. Allow them to watch the video an appropriate amount of times before presenting the task. Next, have the participant perform the skill. By monitoring the individual's progress, practitioners can determine whether the video modeling intervention demonstrates efficacy and ensure fidelity. Finally, fade the video. Training on phases 1 through 3 of PECS, as well as trainings on video modeling implementation, will be presented to Ellison Preschool staff members. Teachers and staff can teach their own students who currently do not have consistent functional communication and play skills. Teachers and staff are also able to teach verbal peers how to accept communication from others using PECS. Teachers will be trained in the first 3 phases of PECS and how to implement training and usage in their own classrooms, as well as 2 sessions of video modeling to teach cooperative play skills. They will also learn how to be both prompters and communication partners. They will learn how to prompt verbal peers to accept pictures from their peers using PECS, and teachers and staff will be trained following BST models. The end goal for students is to exchange with each other independently without engaging in problem behavior. The end goal for teachers is to feel competent and confident that they can implement the skills learned in trainings with their students.
Our training schedule is monthly and it starts in July and it will end in October. For each month, the teachers will be trained on a specific topic and the students will have goals for each month. For the first month, the teachers will be trained on the first phase of PECS, and it will include the students learning how to exchange the icon for an item or an activity they may want. The second month, the teachers will learn about phase 2 of PECS and have their first video model training. This will result in the student being able to exchange with multiple partners and from longer distances. The students will also become competent in video modeling play strategies. In the third month, the teachers will be trained on phase 3A of PECS and have their second video model training. This will result in students learning to discriminate between pictures, and the student will be able to fluently use PECS and video modeling play skills together. The fourth month will be the maintenance phase. In the maintenance phase, the student will maintain play and communication behaviors during playtime. A variety of materials will be needed to complete our intervention. First, the protocols written for PECS and video modeling will be required. Next, PECS icons will be needed for items or phrases that are used during playtime, such as my turn or for Play-Doh. They will also need a PECS book. Play-Doh and tools to match the PECS icon will be needed while watching the video model. An iPad or any other viewing method will be needed for watching the video model, and data collection sheets will need to be used. PECS practice partners will also need to be involved. The video model will have children demonstrating a Play-Doh scheme and utilizing PECS in order to request items or turns. The first step is the client will watch the entire video model. Following the video model, teachers will replay it and pause when needed to prompt steps in the TA and to use PECS. The monthly teacher trainings will each follow the same procedure. First, the targeted skill for that phase will be described. Next, teachers and any relevant staff will be provided with a written description of the skill, which will be the ABA guideline, along with a copy of the matching protocol for PECS or video modeling. Next, the teachers will break off into groups based on PECS or video modeling, and they will switch to ensure that all staff has practiced both skills. By the end of each session, the target skills for each phase will be demonstrated by all staff. A specific procedure for the PECS group includes teachers and staff breaking off into teams of 4 to practice the target skill using the provided BST checklist. This will require a prompter, a communication partner, a student, and an observer who will have the checklist. Teachers are going to provide feedback to one another during practice and will be assisted by a BCBA while they are using the BST checklist. Steps 5 and 6 of the checklist will need to be repeated until mastery is achieved. This is a sample BST checklist for the first phase of PECS. For this checklist, an observer will need to check off yes or no based on if a trainee successfully completes a step or if they do not successfully or only partially complete a step. In the end, a tally of total correct responses or incorrect responses will need to be marked in a box that say tally. The objective of this checklist is to see if a student will pick up a picture of a highly preferred item, reach towards the communicative partner, and release the picture into the partner's hand. This checklist is broken up into sections based on setup, the prompter, and the communication partner. An observer will need to fill out this checklist while within the PECS group as the group members role play, assessing both the communication partner and prompter for mastery of the PECS skill.
When implementing the video modeling procedure, it is important to first follow these instructions provided. The therapist should have all materials needed present, including Play-Doh, a roller, a shape cutter, and an iPad for viewing the video. The materials should be out of the student's reach and the environment should be sanitized. In terms of the iPad, it should specifically be set up in such a way where each student can easily see it and the therapist is able to pause the video after each step. The therapist should also be positioned behind the student in order to block maladaptive behavior and prompt appropriate social interactions. When implementing steps, the therapist should pause the video and utilize most of these prompting. Finally, edible reinforcement should immediately be given after each step. Provided is a sample of the Video Modeling Behavior Skills Training Checklist and a Video Modeling Implementation Checklist for Ellison Preschool staff members involved in a video modeling roleplay. It covers every step that is required for the staff member to show competency in video modeling. The observers in the video modeling groups will fill this out as the group members roleplay, being able to assess both the therapist's role-playing and the video modeling implementation skills. Here's a sample task analysis for the video model that will demonstrate the Play-Doh scheme and how to utilize PECS in order to request turns or needed items. In this brief Play-Doh scheme video, we will demonstrate the simplicity of teaching a child how to use PECS in order to gain access to a desired tangible item. This is also an example of a video we would use as a video model for staff trainings that illustrates the use of watching a video, then using PECS for taking turns and exchanging items.
You're so hungry. You can ask her for the cookie cutter. Go? Yeah. Do you want to go?
Okay, we're good.